Imagine a world where children grow up without the shadows of addiction looming over them, a world free from the relentless grip of drugs. Yet, despite decades of efforts and billions spent, the war on drugs often seems like an uphill battle. Countries around the globe have waged this war, employing strategies ranging from harsh punitive measures to innovative rehabilitation programs. However, the results tell a different story. As addiction continues to devastate lives, families, and communities, we must confront the uncomfortable truth. The strategies in place are failing, leaving millions to navigate a treacherous path toward recovery. In a small town nestled in the heart of America, a mother stood outside a dilapidated house, clutching her child's hand tightly. The haunting echoes of sirens filled the air as police and paramedics rushed to the scene. A young man had just overdosed on opioids. This heart-wrenching moment was a stark reminder of a crisis that stretches far beyond her community, reverberating across nations. The war on drugs has been fought fiercely for decades, yet it leaves in its wake shattered lives and broken promises. As we delve into this complex issue, we must question, are the strategies in place truly effective, or are they simply perpetuating the cycle of addiction? 1. The history of the war on drugs. The war on drugs began in the early 20th century, with various global efforts to combat drug abuse and trafficking. The term gained prominence in the United States under President Richard Nixon in the 1970s, who declared drug abuse public enemy number one. This declaration marked a significant shift in policy, moving towards aggressive law enforcement and harsh penalties for drug offenses. The establishment of the Drug Enforcement Administration, DEA, in 1973 symbolized the federal government's commitment to combating drug-related crime. The strategy included militarized policing, mandatory minimum sentencing, and the criminalization of drug users, which fostered a culture of fear and stigma around addiction. In the following decades, countries worldwide adopted similar measures, often influenced by U.S. policies. Latin America became a primary battleground, with nations like Colombia and Mexico experiencing severe violence due to drug trafficking and cartel wars. While these efforts aimed to reduce drug use and trafficking, they often resulted in higher incarceration rates, particularly among marginalized communities. By the late 20th century, many began to recognize the need for reform, leading to debates about decriminalization and harm reduction strategies. Despite some progress, the legacy of the war on drugs remains contentious, raising questions about effectiveness, social justice, and human rights in the fight against addiction. 2. The global impact of drug policies. The impact of the war on drugs extends far beyond the borders of any single country, affecting global health, safety, and socioeconomic conditions. In many Latin American countries, drug policies have led to an environment of extreme violence, as drug cartels clash with law enforcement and each other. Countries like Mexico have witnessed horrifying levels of violence, with thousands of deaths linked to drug trafficking organizations and their battles for control over lucrative markets. In addition to violence, these policies contribute to systemic corruption within governments, undermining public trust and the rule of law. Officials may be bribed to ignore drug trafficking or to facilitate the drug trade, further destabilizing these regions. Moreover, the criminalization of drug users has led to significant public health issues. Individuals with substance use disorders often face stigma, making it difficult for them to seek help. Instead of treatment, many find themselves incarcerated, which perpetuates the cycle of addiction. The global response to the drug crisis is evolving, with calls for a more humane approach to addiction. Nations are increasingly recognizing that drug use should be treated as a public health issue rather than a criminal one. This shift is essential for addressing the root causes of addiction and promoting recovery on a global scale. 3. Failed strategies and misconceptions. One of the most persistent misconceptions surrounding the war on drugs is the belief that harsher penalties deter drug use. However, research consistently demonstrates that punitive measures do not effectively reduce consumption or addiction rates. Countries with stringent drug laws often see no significant drop in drug use. Instead, they experience higher rates of incarceration, particularly among vulnerable populations. The stigma associated with addiction further complicates the issue. Many individuals view drug users as criminals, rather than people struggling with the disease, leading to discrimination and social exclusion. This stigma prevents those in need from seeking help, resulting in untreated substance use disorders and escalating health crises. Another failed strategy is the reliance on a one-size-fits-all approach to addiction. Different substances have unique effects on individuals, and what works for one person may not work for another. By failing to account for individual circumstances and the complexity of addiction, traditional policies often miss the mark. Moreover, the misconception that addiction is purely a personal failing ignores the broader social, economic, and psychological factors that contribute to substance use. A more effective response must address these underlying issues, focusing on rehabilitation, prevention, and harm reduction rather than punishment alone. 4. Harm reduction, a new approach. Harm reduction represents a significant shift in how societies address addiction, moving away from punitive measures to a more compassionate and pragmatic approach. This strategy acknowledges that drug use exists and seeks to minimize the negative consequences associated with it. It emphasizes the importance of reducing harm for both individuals and communities while respecting the autonomy of drug users. Countries like Portugal and Switzerland have successfully implemented harm reduction policies, resulting in positive outcomes. Portugal decriminalized all drugs in 2001, leading to a notable decline in drug-related deaths, HIV infections, and overall drug use. The focus shifted towards treatment and rehabilitation rather than punishment, enabling individuals to seek help without the fear of criminal repercussions. Harm reduction measures can include safe injection sites, needle exchange programs, and access to treatment services. These initiatives help reduce the spread of diseases, prevent overdoses, and provide individuals with the support they need to transition to recovery. Furthermore, harm reduction emphasizes community involvement and education, fostering a supportive environment for individuals grappling with addiction. By viewing drug use through a public health lens, societies can better address the complexities of addiction, ultimately leading to healthier outcomes for individuals and communities alike. 5. The role of mental health and trauma. Understanding the connection between mental health and addiction is crucial in addressing the drug crisis. Many individuals who struggle with substance use disorders often have underlying mental health issues, such as depression, anxiety, or PTSD. Trauma, whether stemming from childhood experiences, abuse, or environmental stressors, can significantly increase the likelihood of developing addiction. Integrating mental health services into addiction treatment is essential for fostering successful recovery outcomes. Approaches like trauma-informed care acknowledge the impact of trauma on behavior and focus on creating a safe, supportive environment for healing. This method empowers individuals to address their mental health needs while navigating their recovery journey. Moreover, the stigma surrounding mental health often parallels that of addiction, preventing individuals from seeking help. Public awareness campaigns aimed at reducing stigma and promoting the importance of mental health can encourage individuals to seek the support they need. Therapeutic interventions, such as cognitive behavioral therapy, CBT, have proven effective in treating both addiction and co-occurring mental health disorders. By addressing these interconnected issues holistically, treatment providers can help individuals develop coping strategies, improve their mental well-being, and ultimately break free from the cycle of addiction. 6. The stigma of addiction. Stigma surrounding addiction is one of the most significant barriers to recovery, often preventing individuals from seeking help and perpetuating cycles of shame and isolation. Many people view addiction as a moral failing rather than a complex health issue, which leads to negative stereotypes and discrimination against those struggling with substance use disorders. This stigma manifests in various ways, from derogatory language to societal rejection. Individuals may fear judgment from family, friends, and communities, causing them to hide their struggles and avoid seeking treatment. This self-imposed isolation can exacerbate addiction, creating a vicious cycle that is difficult to escape. Combating stigma requires a multifaceted approach. Education is key. Raising awareness about the nature of addiction and its roots in biology, psychology, and socioeconomic factors can help shift public perception. Sharing stories of recovery and resilience can also humanize those affected, fostering empathy and understanding. Advocacy efforts aimed at promoting policy changes that support compassionate responses to addiction can further diminish stigma. Encouraging open conversations about addiction within communities can create supportive environments that empower individuals to seek help without fear of judgment. Ultimately, reducing stigma is essential to developing a more effective and humane approach to addiction, treatment, and recovery. 7. International collaboration and policy change. Addressing the global drug crisis requires a concerted effort involving international collaboration and policy reform. The impact of drug use and trafficking is not confined to national borders. It is a global challenge that demands cooperative strategies and shared responsibility among nations. Organizations such as the United Nations Office on Drugs and Crime, UNODC, advocate for a balanced approach to drug policies, promoting harm reduction treatment, and prevention alongside law enforcement. Grassroots movements and advocacy groups are also driving change, calling for decriminalization, increased access to treatment, and the implementation of harm reduction measures. These efforts are essential in reshaping the global conversation around drugs, emphasizing the importance of public health and human rights. By fostering international collaboration, countries can learn from each other's successes and challenges in combating addiction. Sharing best practices and resources can lead to innovative solutions. A united global effort is crucial for creating a healthier, safer future, free from the devastating effects of addiction. 8. Innovative approaches to treatment. As our understanding of addiction evolves, so too do treatment methodologies. Innovative approaches are emerging that prioritize personalized care and evidence-based practices, recognizing that there is no one-size-fits-all solution to addiction. Medication-assisted treatment, MAT, is one of the most promising developments in addiction recovery. Combining medications like methadone or buprenorphine with counseling and behavioral therapies has shown to be highly effective in treating opioid addiction. This approach addresses the physical dependence on substances while providing the necessary psychological support for long-term recovery. Additionally, integrative therapies are gaining traction in addiction treatment. Holistic approaches that incorporate mindfulness, yoga, art therapy, and nutritional support can enhance traditional recovery methods. By addressing the physical, emotional, and spiritual dimensions of addiction, these methods offer a comprehensive path to healing. Technology is also playing a pivotal role in treatment innovation. Teletherapy and online support groups have expanded access to care, especially in underserved areas. Mobile applications designed to support recovery through tracking progress, offering resources, and connecting users with peers can provide essential tools for those on their journey to sobriety. These innovative approaches signal a shift in how we view addiction treatment, moving from purely punitive measures, the nature of addiction, and the importance of mental health. Educational initiatives can foster informed communities that are better equipped to address substance use disorders. School-based prevention programs have been shown to be effective in reducing drug use among adolescents. By teaching children and teenagers about the risks associated with drugs, as well as developing their coping and decision-making skills, these programs can empower young people to make healthier choices. Moreover, community education initiatives can help break down stigma and encourage open dialogue about addiction. Workshops, seminars, and public campaigns aimed at dispelling myths and promoting understanding can create a supportive environment for individuals struggling with substance use disorders. Incorporating discussions about mental health into educational curricula can further enhance the effectiveness of these programs. By normalizing conversations about mental health and addiction, communities can cultivate empathy and reduce the stigma associated with seeking help. Ultimately, education is a powerful tool in preventing addiction, promoting recovery, and fostering healthier, more informed communities. By investing in education, societies can create a foundation for a more compassionate and effective response to the drug crisis. 10. The future of drug policy. The future of drug policy is poised for significant transformation as countries worldwide reassess their approaches to addiction and substance use. Increasingly, there is recognition that the war on drugs has largely failed to reduce drug use and has often exacerbated public health crises. Shifts toward decriminalization and harm reduction strategies are gaining momentum. Countries like Portugal have set successful precedents by treating drug use as a public health issue rather than a criminal one, leading to reduced overdose rates and improved health outcomes. Additionally, the growing emphasis on mental health and trauma-informed care is reshaping treatment options. Policymakers are beginning to recognize that effective drug policy must address the social determinants of health, including poverty, education, and access to mental health services. Advancements in technology, such as telehealth and digital support platforms, are also revolutionizing access to treatment. As the global conversation evolves, a more compassionate, evidence-based approach to drug policy is emerging, promising a future where addiction is treated with understanding and support rather than stigma and punishment. The war on drugs has revealed the limitations of punitive approaches and the urgent need for a paradigm shift. Countries must recognize addiction as a complex health issue, requiring compassionate and comprehensive solutions. By embracing harm reduction strategies, integrating mental health support, addressing stigma, and prioritizing education, we can pave the way for a more effective response to addiction. The journey toward healing is not a straight path. It is filled with challenges and setbacks. However, by fostering a culture of understanding, empathy, and collaboration, we can create a world where individuals struggling with addiction find the support they need to reclaim their lives.